So welcome everybody to this webinar where we're going to discuss equity in neurosurgical research and discussing the challenges and opportunities we have globally in this subject. So I am excited to announce that we have three speakers, and the first is going to be Dr. Ignatius Isine. Then it's going to be Dr. Andreas Dimitriadis, and last, Dr. Ebenezer Tirset. The reason why we thought about this topic was to think about, when you think about medicine, we all want to treat patients better, and we do research to get evidence-based medicine to adapt our treatment to specific patients. And unfortunately, there are many areas where there is an inequity in healthcare, where people don't have enough infrastructure, not enough resources to actually do the so-called protocols. But also we need to acknowledge that a lot of research is being done on not a diverse group, which might give some implicit biases when you want to give treatment to people. So in that sense, I think it is important to talk about research equity and what we can do when we talk about publishing of research, etc. So I'm excited to introduce the first speaker, and that is Dr. Ignatius Isine. He is from Cameroon, a consultant neurosurgeon, a researcher, but also the deputy editor-in-chief of Journal of Global Neurosurgery. Please proceed with your presentation, Ignatius.
Thank you so much, Eliane. Good evening to everyone. Good evening, Dr. Andreas, Vanessa, and attendees. Just give me a few minutes to share my slide, and then we go. Okay, so thank you so much. It's a great honor and pleasure for me to be here this evening to talk about a topic which I'm so much passionate about. And I'm so much grateful to the organizers of this webinar, particularly Eliane, with whom we've been communicating for a very long time. Andreas, I worked with him when he was the president of the EANS, and my friend Ebenezer from Ethiopia. So I think everybody on board are people we are very familiar with. Sometimes, about 10 years ago, we started asking a few questions about what research and training in neurosurgery looks like, because as neurosurgeons, our call is to treat patients, offer surgical treatment to patients. So we were much more concerned with what was happening in the domain of education and training, because especially in LMICs, where there's a deficit in the workforce and a very high volume of patients, and therefore neurosurgeons in this part of the world spend a lot of time treating patients and no time for research. So we started trying to evaluate to find out what's actually happening. And we came up with a few conclusions. We all know that the practice of neurosurgery has changed over time. It has evolved from just a pure clinical practice of neurosurgery to involve the clinical and the public health practice of neurosurgery, which today we call the global neurosurgery. But it hasn't even ended at that level. There are other elements of neurosurgical practice, which include education, advocacy, policy development, and of course, research, which we are going to be focusing on this evening. So we know since the 1990s, when the concept of evidence-based medicine was introduced, neurosurgery too joined the other fields of medicine. And so the practice of neurosurgery today is well accepted based on the paradigm, which is that of evidence-based medicine, which is the judicious, explicit, and the practice of neurosurgery based on evidence, based on the available evidence to provide optimal care to the patients. The practice of evidence-based medicine has a number of pillars. The key pillars include research evidence, surgical expertise and experience, patients' values and preferences. And that is why today we are focused on research. over the years, we've tried to look at the challenges faced in the domain of neurosurgical research, and we realized that there are three main kinds of challenges which research in neurosurgery is facing. The first kind of challenges are those related to the quality, that is the quality of neurosurgical research, be it the way it is conducted or the way it is reported. The second kind of deficiency is in the research output, that is the productivity, and these are related to inequities and inequalities. And they do terminologies which are totally different. And quite recently, there's a lot of talking about ethics in neurosurgical research. So today, we will focus mostly on problems related or challenges related to the quality and the productivity of neurosurgical research. We've looked at these problems over the past years and realized that the problems related to neurosurgical research, especially in the LMICs, it's true that these problems are found both in high-income countries and low-income countries, but they are much more felt in the low-income countries. And these problems are related to the way research is conducted, from data collection analysis to the way it is published and the way this data is made available to the users, the end users, who are the neurosurgeons or the neuroscientists. Therefore, a few months back, we wrote this paper, which were very much concerned with the way things have been happening, especially with respect to the deficiencies and the disparities in neurosurgical research. And we try to look at the determinants, their frequencies, and how to actually solve these problems. We will start with the first problems which we detected. The first thing is that we all know that medical research or biomedical research is broadly divided into two groups. We have laboratory research, and then we have clinical research or bedside research. And when we look at bench research, very few neurosurgeons, especially those in LMICs, are actually involved in bench research because, first of all, you need a lot of resources to do that. There's a lot of technicalities involved. A lot of infrastructures are needed to realize this kind of research. So therefore, it is very limited. So there's very low research productivity with respect to laboratory research coming from LMICs. It's true, even in the high-income countries, when I spent a few months doing my fellowship, I also realized that there are very few neurosurgeons in high-income countries also involved in laboratory research. So, but for us, we know good clinical practice is also depends on good findings that come from laboratory research. So we actually therefore need to encourage the production of good research from the laboratory. When you look at clinical research, broadly, clinical research is divided into quantitative research and qualitative research. The domain of qualitative research is poorly developed not only in the neurosurgery, but in all surgical specialties. And you'll be very surprised that this paper, which we published just about 2 years ago, was one of the first papers published in qualitative research, where we look at the methodology of qualitative research in a neurosurgical practice. So there are very few papers published in this domain, and we know that quantitative research and qualitative research are complementary. For us to be able to assess certain parameters in medicine, such, for example, pain, we need to look at the quantitative part, maybe the visual analog scale, and so on and so forth, and then the way the patient actually perceives the pain to actually get a good understanding of these parameters. When you go to the domain of quantitative research, again, these methodologies in quantitative research were not well developed until in 2016, when we published, actually, this was the first paper published on quantitative research designs in neurosurgery. So we realized that most neurosurgeons used to call most of their cases just case series. They never used to bother about the study design. They never used to bother very much about the statistics used. And this was a very big issue, especially when it comes to pooling studies together to produce meta-analysis, because poor quality primary studies combined to produce systematic reviews and meta-analysis will lead to faulty results. So we therefore started looking at the quality of quantitative research designs in neurosurgery. And we realized that there are two major problems. Although there are so many challenges which we found, the two most important are deficiencies or challenges related to the way research is conducted, that is methodological challenges, and those related to the way research is reported in neurosurgery. As I said, of course, there are so many of them. We can't go into all of this today. Maybe we can discuss them during the discussion. But the most important, which I'm going to underscore this evening, are challenges related to the methodology and reporting of quantitative research designs in neurosurgery. So we look at these challenges in neurosurgery in general and specifically to spine. Okay, and we realize that generally the quality of research methods in neurosurgery was generally very poor. And we were asking a question, how can we fix this? Because how was the quality assessed? This was assessed using tools which were developed recently, but most of these papers were published before these tools were developed. So therefore, we became worried on how to actually fix out these problems. We will discuss about the solutions later on during our presentation. So these were some of the challenges that we found. We realized that up to 15% of studies published in neurosurgical literature as case reports had nothing to do with the basic definition of a case report as known by clinical epidemiologists. You will be very surprised that up to 70% of studies that were published as case series in top neurosurgical journals were not actually case series. Most of them were descriptive cohort studies, and about half of case control studies were actually a misclassification. Randomized surgical trials are, of course, very poor quality, not to talk of the systematic reviews and meta-analysis, which are the results of these primary studies. So we are very much concerned about these challenges, and we provided solutions in most of these papers which we published. When you look again at the overall quality of research in neurosurgery, looking at the different study designs which are involved, you realize that about most of the study designs published in neurosurgery are level 4. About 40% are just level 4. Just about 2.2% of neurosurgical research is made of level 1 evidence, that is from randomized surgical trials, which is contrary to what we see in other specialties like orthopedics, where this goes above 20%. So neurosurgeons are training behind other specialties like orthopedic and the urologists. So we therefore need to step up to produce high quality research, which we are going to apply through the principles of evidence-based medicine to provide optimal care to our patients. So these are the most accepted guidelines to conduct and report research in clinical epidemiology, and which has been adopted by all the different fields of medicine. Okay, if you go to Google and type on the equator, that is enhancing the quality and transparency of our research, you are going to find the tools which are going to help you to write good descriptive studies and how to report them, tools which are going to help how to write and report good observational studies, tools which are going to help you how to conduct and report good clinical trials. So this, I'm not going to go into details of this. So, but if you go to internet, you're going to read about all this. So we look at the challenges related to the quality of the different studies in quantitative research. These problems are ubiquitous, okay? But when you go to the problems related to research output, these are very, very much common or very conspicuous when you look at countries in the developing world, that is the LMICs. And there was this paper which was published about a decade ago that looked at the research productivity across the world, published in top the 3 journals. Then we had a neurosurgery, Journal of Neurosurgery, and ACTA. You know, today ACTA has been replaced by Brain and Spine, which is the official journal of EANS. And it was demonstrated that up to 75% of research comes from high-income countries, that is from North America and Europe. You see that the rest of the world, Africa, Asia, and Latin America, they're contributing to less than 25%. Which was really very scandalous. And in a recent paper, which published by Professor Franco Savada, he demonstrated that LMICs account that produce only about less than 5% of research output. And these 2 papers which we did with Professor Keeper, we show that there's actually a disproportionate representation of authorship in neurosurgical research, especially in global neurosurgery. And that's why you see there's a lot of talking about these disparities in recent years. And when in the WFNS Young Neurosurgeon Forum, when I worked with Angelos and Professor Franco was the president, we look at all this into details, and we realized that this was because many young neurosurgeons who are the active force in research productivity were not actually trained in research. And as you all know, in most LMICs, the training program is about 5 years, 4 years, 5 years, and research is not part of the training. That is, there's not a year dedicated to training, contrary to maybe to programs found in North America, where there's a year dedicated to research. And as you can see, whereas young neurosurgeons in high-income countries reported, about a third reported that they lacked enough skills to produce research. Up to 2/3 in the LMICs reported this problem. And why is this a problem? This is a very big problem, as you always see in most of the presentation of Professor Franco Savada, who is an eloquent, somebody very eloquent about research inequities. If you look at the problem like traumatic brain injuries, which is a public health problem and which is very common in low and middle income countries, you realize that it accounts for, if you look at the data globally, the burden of traumatic brain injuries, up to 70% of the data, okay, of the cases occur in low income countries, but most of the research that is used in developing guidelines come from high-income countries. So what is the consequence? Definitely when you do research, you have data from a particular study. The data is internally valid, but you cannot generalize it to a wider population if the data is not going to be applicable, especially when the settings are different. So therefore, this poses a problem of the generalizability of guidelines and the applicability in settings where data is not collected from there. So that is exactly why researchers from LMICs need to actually participate in producing research, so that when these guidelines are developed, they are going to be incorporated to them, and so that these guidelines becomes applicable in these settings. So what are the major determinants of research or of research inequities in neurosurgery? One, if you look at the situation in LMICs, lack of infrastructure, there are very few departments of neurosurgery with laboratories, anatomical laboratories, basic science laboratories, or clinical laboratories for the residents and young neurosurgeons to conduct research. There are very few young neurosurgeons with enough competence, okay, who have been trained in research. And also there are very limited opportunities for them to publish, okay? Because if you look in most LMICs, some of them don't even have journals, neurosurgical journals. So even if somebody does research, he has difficulties in finding a medium through which this research can be communicated. If this research has to be sent to journals in high-income countries, sometimes they don't meet the standards in these journals, and therefore they are rejected at the level of the bench. So it becomes very challenging, and research productivity from low-income countries becomes very minimal. Of course, most journals have a role to play in the way research is produced across the world. If you look at in the top 13 or 15 neurosurgical journals, most of them are based in high-income countries, and of course with their own agenda, because most journals are created with a particular focus, with a scope, okay, with an agenda. And when papers come from other parts of the world which don't fall in line with the agendas of this journal, they are not accepted. So therefore, since most of the journals are found in high-income countries, and research coming from low-income countries, the rejection rate is sometimes very high, and therefore this contributes significantly to the low research output from low-income countries. What about language? It's true, the language of science is English, and most of the world doesn't speak English. So most people struggle with English, and therefore to even write a paper in a language which is understood by everybody becomes difficult. So sometimes even somebody has a very brilliant idea, to convey the idea becomes very difficult when the language power is not there, okay? And one of the things which we've also been talking about in recent times is issues related to funding. If you look at the grants, you look at the way funding is distributed across the world, most of the fundings come from high-income countries, and you cannot do good research without funding. Okay, you need money, you need other resources to be able to do good research. So where is this coming from? This is coming from high-income countries. Governments in low-income countries, unfortunately, do not accord a good percentage of their budgets into research. So therefore it becomes very challenging. Gender is also another issue. We all know that there are very few women in neurosurgery, that's true. And the few who are there are also trying their best to contribute to neurosurgical research. And the fact that there are very few female in the few women in neurosurgery is already a factor which accounts for the low research output from the women. And then again, there are other factors that impede the women who are already in neurosurgery to be involved in research, and this accounts for the discrepancy you find between the male and the female gender in terms of research productivity. So I've elaborated much on the determinants, that is the challenges which are related to research productivity in neurosurgery, and I've emphasized very much on gender, okay? And we've seen in most papers which are published, be it in neurosurgery or other surgical specialties which are close to neurosurgery, like the EANS and the spine and so on and so forth, there is a very big gap between the male and the female. It's true, this gap has been closing up in recent years, but if you look in terms of authorship and editorship in journals, there's a very limited representation of the females. And this occurs because this problem starts from medical schools. It's true that the number of females in medical schools is gradually increasing. For example, in the United States, it's almost about 50%, but this is still very low in most countries across the world. So therefore, since there are few females entering the medical schools, and among the few that enter the medical school, there are a limited number that get into neurosurgery. And together with all other external factors, which we might talk about during the discussion, this accounts for the gender gap you find in research productivity in neurosurgery. We've been trying our best to promote the women or the females who are in the medical field and in neurosurgery. We support medical students and young neurosurgeons in research productivity, because we know that for this change to occur, we need to focus more on the medical students who most of the time assist in data collection, and the young neurosurgeons who are the active workforce involved in research productivity. Journals have a very big role.
One more minute. Sorry.
Yeah, journals have a very major role to play in curbing research inequities. That's why in the Journal of Global Neurosurgery, we've created a journal which is open access with no paywalls to mitigate this gap. and we ensure that there is equitable authorship in publications, especially that involving authors from high-income countries and low-income countries. We've also tried, even though we have the advent of open access comes with a cost, because open access has led to the proliferation of predatory journals because people pay into journals which are not of good quality to publish, whereas with a subscription-based journal, this wasn't occurring. There are also many problems related to other LMIC's journals because they are not indexed in PubMed and other major databases. So even if publications are done in these journals, they are not detected when guidelines are developed. So therefore, we need good search engines to be able to detect these articles published by authors from low-income countries. And before I conclude, there are inhibitors, desensitizers, and stimuli and accelerators to help researchers in LMICs to increase research productivity. I'm not going to go into the details. You can consult this article, which we published a few years back. These are the inhibitors and the desensitizers. These are the stimuli and the accelerators, which can help to narrow the gap between high-income countries and low-income countries. We talk about, there was a Bogota Declaration, which one of the major, with a lot of, which was one of the initiatives taken to narrow the gap between high-income countries and low-income countries. And recently, in a few weeks, there's going to be the Boston Declaration, which is going to be focused on, one of the aspects they're going to be focused on is on research inequities, aside other things related to global neurosurgery. So with all these initiatives, we are very sure that if researchers from high-income countries and low-income countries come together, we are going to be able to mitigate the deficiencies and the disparities in neurosurgery. We all have our responsibilities. For researchers in low-income countries, we need to be trained in research. We need to understand the concepts of evidence-based practice. And this warrants that we understand we have a basic knowledge in clinical epidemiology, statistics, and evidence-based medicine. And for the researchers in high-income countries, they need to provide that mentorship, and they have to act equitably in collaborative research to support researchers in the low-income countries. Thank you so much.
Thank you for that presentation. You talked about various aspects of the challenges, but also the opportunities, and actually talked about many things that I think a lot of people worldwide have had experience with. They finally being able to do research in a setting that does not have the infrastructure, then getting the knowledge to do that correctly, write a paper, then trying to get it published, and then getting it not accepted, trying to figure out why. The answers of it not getting accepted is not always based on the research. If I take myself, for example, I've had, articles declined because it doesn't represent whatever the readers find interesting. And then I'm thinking, how do you know? Because, if you look at this whole issue of medicine and publication and research, it all stems from globalization, right? The fact that research has been done in countries that don't have the resources, other people were doing the research before that on those populations, and then authorships were from high-income countries, and then the local physicians were somewhere in the middle or not even at all on it. And these rules that were posed in history, like historically, is something that kept everything skewed and still is to this day. So with the Journal of Global Neurosurgery, you try to change that by, making sure that people don't have to pay. Having an editorial board that is extremely diverse from all over the world. Of course, that is also your journal, right? Global Neurosurgery. So you need to be diverse. What do you think? Like I even actually published in your first issue after being asked to publish something about the Caribbean. Do you think that the issue of not being indexed, like not indexed papers, do you think people don't take that as seriously as indexed papers? Do you think that indexation is a need to get, the proper acknowledgement? How do you feel about that? And is there a future where Journal of Global Neurosurgery is going to be indexed?
Thank you so much, Eliane, for this question. I think it's a very interesting question. We all want when we publish, we want the research to be used, okay, to be translated into something which is going to be useful to humanity. We don't just want to do research for the sake of doing, except maybe in academia where people want to change grade. So when we were conceiving the Journal of Global Neurosurgery, we had in mind, and we have in mind, that the papers are going to be indexed retrospectively, okay? So it's something which we take very serious. So it's not like, because indexing is a very important factor. I showed in one of the slides that there are a lot of papers or a lot of research work done in LMICs, which is published in journals, which are not indexed. So therefore, when people search for this, they don't find it. So indexing is it is very essential for your work to be seen, for your work to be cited, for the work to be useful. It has to be indexed in places or in databases where people can actually detect the work. So with respect to Journal of Global Neurosurgery, it is not indexed maybe in PubMed at the moment, because PubMed has some criteria for a journal to be indexed in it. So we're working towards that. It requires a certain number of papers. It requires a certain number of tools, a number of criteria that are put in place. So I'm sure within the next coming months to years, we're going to make sure that it is indexed in PubMed. And once it is done, all the papers that were published before are going to be transferred to PubMed. So I know indexes is a very important issue. I think Andreas wants to add something to that there.
Yeah, go ahead, Andres.
Thank you. First of all, thank you, Ignatius. Congratulations, a very crisp presentation and highlights a lot of the important challenges, but also opportunities in how to move forward. It's a very important topic, and I don't think we can solve it in an hour. However, there are a couple of things that are worth mentioning. For example, also one of our colleagues on the chat group, Dr. Gohari, comments that there are funding issues not only in LMICs, but also in high-income countries. And within a high-income country, there's always a layering, a stratification of those who are better resourced than others in terms of basic science or clinical research or trial work and so on. But to go to the topic of indexing, we faced the same challenge when we launched Brain and Spine. Brain and Spine is only 3-4 years old. So when we started the new journal for the EANS, and in fact, it's partly owned by EANS and partly by the Eurospine, the Spine Society of Europe. Before that, we had other journals that were affiliated with, but we did not own them. So we decided eventually to do our own journal project. And of course, at the beginning, when you're not indexed, nobody wants to submit, because people from all over the world, wherever you may work, the higher the importance of the journal, or whether you call it impact factor or not, or site score, etc., whatever the metric you may use, it affects your funding, perhaps. It affects your points that you collect at your institution. In some countries, some journals are more allowed than others for PhDs and whatever. But we decided that as a society, we had to support this non-indexed journal until it gets indexed, because we know that if we don't support it, nobody else will. Therefore, we launched this enterprise, if you like, and it was a well-known fact that we should all contribute and we should all be patient, because to get indexed, it's relatively straightforward. There are certain criteria. For example, you have to have a certain number of publications, I think it's 25 or more, and you need to have certain background checks. So sooner or later, it happened, and now the impact factor is as good as ACTA and World Neurosurgery. Those are journals that have been around for 75 and 25 years respectively, versus ours, which is 3 or 4. So the good news is Journal of Global Neurosurgery will be indexed, and Ignatius and his team will be indexed sooner or later. This is just a matter of ticking a few boxes, and everything that they have produced will be retrospectively suddenly appearing on PubMed. The other thing, of course, to remind everyone is that there is the DORA declaration, that it's not the impact factor that matters, it's other things and other metrics these days. But on the whole, I am confident about the Journal of Global Neurosurgery. It's an innovative project because it's open access and there's no fees to the authors or the readers. Whereas open access, as we know it in the modern world, is a lot different, and it's actually not a good arrangement. But we can discuss that more later. Thank you. Ignatius.
Yes, Ignatius.
Yeah, I just wanted to underscore the last point he spoke about the open access. You know, most open access journals are different from the subscription-based journals in the fact that the author pays, okay, and the readers, they read for free. And again, if and we know funding is a major issue for those in LMICs, so they don't have money to pay to publish. But with the Journal of Global Neurosurgery, there is no, it's gold open access. That is, you don't pay anything to publish, and the readers, they pay nothing to read. It is a model which is good. It's a model which we've been thinking that it can be applied to other neurosurgical journals. But how sustainable is that? The problem of sustainability comes that somebody needs to pay for the staff, because you know, with the other models, I mean, when the researcher pays in the normal open access model, at least that money is used to run the journal, the office of the journal. But when you have it completely free, you know, generally in life, there's no such a thing as a free lunch. Then somebody must be paying somewhere. So having it totally free comes also with some setbacks. The fact that we need to get maybe some donations and some free donations to help support in running the office of the journal.
I wanted to read out a question from Dr. Toussaint. He has put in the chat that in terms of high rejection rate from researchers from low middle income countries, how do we redefine what is acceptable for publication, specifically pertaining to LMICs? Is Journal of Global Neurosurgery the answer?
That's a very good question.
Sorry?
So that's a very excellent question. Yeah, as I said before, every journal has its policy. Okay, there's a scope for every journal. If you send a paper about, I don't know, brain tumor to a journal which is vascular, they're not going to accept it. Okay, so of course, exactly.
No, I mean, if we just keep in mind, okay, so let's set the stage. We have a paper that is basically very well done. It does not have any known authors. It is based in LMIC. It's sent to, I don't know, whatever journal that is known, and it gets rejected because it's not in the interest of the general public. I don't know, whatever. They say, then what is the
idea of Journal of Global Neurosurgery was born to ensure equity in research publication. So as I said in one of the slides in the paper which Professor Franco Savadai, which he published, he showed that we have just less than 5% of publications from LMICs. So if we need to develop guidelines, which is something he's always talking about, we need to get papers also from LMIC. We don't need to focus on papers just based on novelty or based on some new ideas that's going to contribute to science. So at one point, we need papers from LMICs, even if they are not, it's not something new in medicine. For example, if I talk about management of traumatic brain injuries in children from Cameroon, well, many papers have been published in sub-Saharan Africa, published across the world. It's not something new. I'm just sharing my own experience, but it's not new, but it's going to provide data to ensure that we incorporate data from sub-Saharan Africa into global data to produce guidelines which we can actually generalize. So we can accept such a paper in the Journal of Global Neurosurgery. It's true. One of the things we do in Journal of Global Neurosurgery is to provide editorial support and language support, which means that what? If the paper is of good, if the idea behind the paper is good, and we realize that there's a problem with the content, and there are things which can actually be changed, we can assist the authors, okay, to do that modification. Okay, if they did bad statistics, for example, instead of reporting the median, they reported the means, instead of maybe reporting, I mean, these are things that can be changed. If the paper was published by somebody who is French speaking or Latin or Portuguese speaking, and we realize that the concept is actually good, we can assign the paper to somebody that can actually edit the language and get the paper published. Because I said, the whole idea is about equity. We need data from this part of the world to ensure that there's equity.
And do you accept will that be done with a monetary compensation, and people need to pay for that, or is that also free of charge? Because most of the journals, they do have they give the option to have the English checked, they give the option to reduce fees, but you always need to pay.
The whole concept was to get everything for free, nothing to be paid.
But how is that sustainable?
That was the question I asked. So that's why we have to keep on looking for donors, okay, to support the journal.
Yeah. Hold on, there's a question, and the person apologizes if the question was already asked, but how can open access initiatives help neurosurgeons in LMIC access cutting-edge research without financial barriers?
You want me to answer? Okay.
Whoever.
Yeah, so open access came, initially most of the journals were subscription based. Okay, subscription based means that you send a paper to a journal, okay, when the research is published, people who need to read or have access to the research need to pay a subscription fee, or you can access the paper through your institution, okay. That was a very difficult model. So people shifted to the open access with the idea that open access is going to maybe try to bring in equity for the fact that people easily have access to the paper. But even if the majority of the users have access to the journal, to the paper, somebody has to pay to get the paper published, and who has to pay is the researcher. So somehow, open access provide some sort of an advantage to researchers LMIC, but it's also disadvantageous because the researchers and LMICs have to pay. It's true that there are some organizations or there are some publishers, they are creating some models where if a paper is submitted with all the researchers from LMICs, the subscription fee can be waived, or there's some discount. Okay, but again, as I said, it depends on how you look at it. Somebody has to pay either to publish the paper or to get it accessible to the readers.
Yeah. Okay, let's go to Dr. Terzit for his talk. He is a consultant neurosurgeon in Ethiopia, and he has done his PhD.
Eliane?
Yes.
Sorry, I'm so late. I had computer problems. I apologize so much for that. So Anna has helped me for half an hour. We tried to get into it. So now I'm on my small phone here instead.
Okay.
And I know Ebenezer very well. So because Ebenezer is an amazing guy, because he's a neurosurgeon from Ethiopia, but he's done a PhD in Norway, in Bergen, while working in Ethiopia at the same time. So it's a very, very good a large project, and I was honored to be his opponent in Bergen. So I'm very, very glad to see him again. So that's why I just would like to say that. And sorry again, I hate computers, and it's a new computer, and I have been really struggling. Sorry to all of you. So Ebenezer, are you there?
Yes, yes. Thank you,
Yeah.
Dr. Ma.
Good to see you again.
Thank you.
Always nice to see you. You have a more beard now than last time.
Yeah.
Okay, thank you. You're
Thank
welcome.
Okay, please share your screen. So we are very interested in your presentation. Yes.
Yeah. Yeah. So I hope you can. Yeah. Thank you very much, Dr. Elle, Dr. Magnus, and the EANS Global and Humanitarian Committee for giving me the opportunity to share my experience in conducting research in low-income country. So, as Dr. Ignatius said, there is a significant challenge for research in LMICs, but despite these challenges, there is a distinctive opportunities due to mainly the growing disease burden, which has contributed for improvement in the field of research in the LMICs, and access to diverse patient population are addressing health disparities and case volumes and developing new treatment, new treatments and therapies have been listed as some of the opportunities, and resource, logistic challenges, and ethical considerations are some of the challenges in conducting research in LMICs. And when we see equity in neurosurgery researches, there is a significant disparities globally in neurosurgery research, despite the growing burden of diseases and the growing demands from resource-limited setups. So the objective of my presentation is I will try to show my personal experience and challenge in research career development, and I will try to show the impact of socio-economic factors and healthcare disparities in conducting research. So I will try to share my experience, what motivates me to pursue research and PhD career, and my research engagement and the opportunities and challenge I encountered along the way, and I try to see the things I learned through the process and my experience while working with the long distance supervisors, and I will try to show my reflection and conclude. So among the things which motivated me for research career is while I joined a neurosurgery training program in our institutes, we are among the first few candidates to be trained locally, and there was little experience, and that was an opportunity, and we had a significant unmet needs, and during our daily clinical practice, we encounter a lot of challenges, and we have a huge caseload and a busy clinical schedule, posing a lot of questions which need answers. And I had an opportunity to visit centers abroad while I was a resident and during my early career years in neurosurgery, and I was able to see the best practice and center with better experience. And this international collaboration, my supervisors from abroad motivated me to pursue this research career. And in our institute, the neurosurgery training program, there is a mandatory research work. So to graduate, you have to do one research and present. But there is a limited availability of structured courses, and the quality of research is even though the quality of research is improving over the years. And as a resident, I had a chance to report and publish interesting cases and cohorts with the guidance from mentors from abroad. And the international collaboration was invaluable. And the enormous unmet needs locally and my personal enthusiasm for improvement helped me to work together with my colleagues in developing neurosurgery database in our institutes, and which was one of my initial exposure to work in a research team. And our university also promotes multidisciplinary problem solving research projects, and they support the project, and also support international collaboration, experience sharing, and transfer of knowledge and technologies. And I had an opportunity to apply for a grant in our institute and get a grant, and which was one of the input which had been one of the inputs for me to join the PhD program. And I had an opportunity to be enrolled into a clinical PhD program at the University of Bergen in Norway. And this was one of the great milestones in my research career. And through research, it's a better way of seeing the impact of the service we are providing to our patient and to the community in general. And I learned how valuable our work is, and things which needs to be improved through research. So to share some of my experience in my PhD journey, I registered in 2017 and finished in 2024, and the training included mandatory in-person and online research courses, and planning and projects, and also data collection, data analysis, and manuscript writing under supervision. And some of the opportunities I had was we have a huge caseloads, and in one of my study I was able to enroll 228 children operated primarily for neural tube defect closure within 1 year in a single institute, and we were able to have 1 year follow-up for 62% of the study participant on this study. And we were also able to find out the ultrasound prevalence of neural tube defect in 958 pregnant women in Addis, and the risk factor behind the intrauterine neural tube defect. And these were some of the works I was being able to achieve through this project and training. And among the challenges during my PhD journey, I had a 3 years delay from my original PhD period, which was due to the COVID infection and conflict locally, and the travel restrictions, which restricted me from traveling to Bergen to attend courses. And I was not able, due to the data transfer policy at the University of Bergen, I was not able to send data, but I had to have my data together with me while I traveled to Bergen for the data analysis and manuscript writing, mostly done under supervisions. And the lower follow-up rates and some of the inadequacy in the data recording techniques while we were collecting data here in Addis was some of the challenge. And regarding time allocation, so I was actively working my full-time clinical responsibility while doing my training. So this was there was a challenge in time management also. So this was some of my experience, and along the way there were some opportunities and challenges, and getting a mentor for several years throughout collaboration in neurosurgery was one of the important opportunity I had, and a gap and interesting challenge that needs to be investigated was also an opportunity, and a chance to join a structured clinical PhD training program is also another opportunities. And despite the policy level advocacy, attention given to clinical research needs improvement in our setup, and it's uncommon to get research leave in our setup. So this is one of the challenges I encountered along the way. So through the processes and through the formal training by being involved into the PhD program helped me to learn the correct way of doing things in a reasonable time. And includes starting from identifying a problem, synthesizing a problem, statement, planning, and actually running a research project. And while working on my project, I learned that in addition to the scientific process, communication, negotiation skill were equally important and needs continuous improvement. So my experience while working with long distance supervisor is I had a committed supervisor who was willing to help and guide me through the process, which was invaluable, and giving adequate time to the study to study the project, and training before meeting your supervisor is also important. It helps you to use the available time wisely, and internet communication, being understanding follow-ups and tests are also valuables, and an opportunity to see things differently, appreciate like variables way of approaching things, and learning from someone who has much more experience with was very valuable, and this was one of the things I learned through the experience. And as a reflection, the ultimate result makes you to be part of the solutions, and understanding the gap and learning from each component of the trainings and the projects makes you a capable researchers. And the program equipped me personally with the skills to address globally relevant problem through experience and collaboration. And this was a picture taken after my dissertation together with my opponent and supervisors at the University of Bergen. And as a conclusion, the role of research in addressing global neurosurgical needs is invaluable, and attention should be given to address inequities in neurosurgical research. And formal training in research is valuable, and international collaboration focusing on capacity development is important, and career paths in research like PhD program should be supported. And thank you very much.
Thank you, Ebenezer. It's a fantastic journey you've done, and I'm very impressed by you.
Yes.
So in the support, you mentioned that, but in the support from Bergen, from your collaborators, the key points you said to make it work, because it's very difficult to be supervised at a long distance. So can you repeat what are the main key points that make it work?
One of from my experience, one of the thing is to get like a committed supervisor who is willing to guide you through the process, give you adequate time and follow you. And the other thing is the candidate, the trainee, has to also commit and work actively on the project. And since you have limited times for meetings and follow-ups, you have to make best out of it. So you need to prepare before the meetings, and you really have to work hard on like your assignment homeworks, to make best out of the available times. So I think these were some of the experience I got.
Yeah, and what did you learn from choosing research topics, so to say? I mean, you can choose something too difficult, you can have a too ambitious plan, and so forth. How to make it reasonable?
Yeah, the research topic I chose was the one I chose while I was a resident in Addis. So so it was like it was a very common problem we see here, and the output from the research was very valuable to address the gap, and it so for that reasons. Like through the mentorship process, I was being able to be trained how to properly approach and investigate like this overwhelming problem, I would say.
Yeah, thank you. Any questions from other people than me? I've questioned Ebenezer so many times before on the dissertation, so I should not do it anymore.
Ignatius has a question. He has his hands up.
Yeah, please. I can't see the hands.
Thank you, Ebenezer, for the very inspiring presentation that tells us about your journey. I mean, I know Ebenezer, I mean, I stopped at Addis Ababa at one point and we had dinner together. So your journey to getting a clinical PhD has been one that is very motivating, which is very inspiring to young neurosurgeons. I mean, do you think that every African neurosurgeon should get a PhD in the clinical neurosurgery? And if yes, how do you think how did the PhD in clinical neurosurgery change your practice or your neurosurgical practice?
Yeah, thank you very much, Ignatius. Yeah, it's a pleasure to meet you too. But I think academic and PhD training careers are very valuable to develop a department or neurosurgical institutes, and they should be promoted. But when we say when we talk but when we see the paths or the career paths, so there are the different components of the career paths, and so not everyone should get a PhD, at least in our setup. But this is going to be a very important career, and there should be individuals who are who are well educated, and who have who has to follow this career. I think it is very important to develop the system, the departments, and overall the activities in our setup also.
Andreas, you
Thank
wanted
you.
to mention something? Yeah.
I just wanted to congratulate Ebenezer for obviously an excellent presentation, but more importantly for two other things. The PhD itself was a feat. You did it through COVID. You did it from long distance, and you did it with a very impressive volume. I mean, it will take a decade, maybe 2 decades, for someone to do in Europe the kind of work you did in neural tube defects. So well done for being a role model. You are a role model for many people who are thinking about things perhaps, but don't know where to start. So I think we should make it somehow easier for them, and maybe we can write a small summary of how you did this and use it on our networks. Magnus, perhaps we could do that as a summary
Yes.
of this.
Actually, Russell Andrews wrote in the chat something. Maybe Russell would like to comment on that. That he would like it as a newsletter, even. Yeah.
Yeah. But my question to Ebenezer is, how do you see yourself back home now, continuing clinical research, and how, and also in addition to that, how can you implement the lessons you learned so that you can you be the supervisor for others?
Thank you very much, Dr. Andres. Yes. So that is my that's what I want to do next. Yes, and it's challenging because there is no path which was previously plotted, or there is no to run a program. But we have a neurosurgery training program, and the residents are expected to do a research before graduations. And there are over the years, there are a lot of interesting topics being investigated, and the quality of research are also improving. And I think this could be one entry point, to start a PhD project. And this we have to do it with our institutes, and there is a need or interest from our institute to have a career path like this. And I hope together with my colleague who previously did the same PhD program, we will be able to have some kind of program running in our institute.
I have another question to both you and Ignatius, Ebenezer, and that is, I know that you went to the Bergen courses, research courses in statistics, ethics, and so forth. You think you can do that like on the continental web-based model? Because people are very lonely in their institutions, so and it's difficult to get on these courses. Is that possible in the future to have some common courses in like research, ethics, statistics, methodology, and so forth?
Yeah. Actually, before starting my training in neurosurgery, I had a master's in public health in Brussels.
Oh, yeah.
Yes, ULB called the Santé Publique. And then the two major courses were clinical epidemiology and statistics. It's true, they had other courses in advanced research methods, hospital management, health economics, and so on and so forth. So after my training, I came back to Cameroon and in Africa. In 2019-20, we started a research course for young African neurosurgeons. So it was a course that had 5 modules and had to go. And this course became very, very much important, especially during the COVID period, where many people were not in the hospitals and most of the evenings they were at home. So we had a curriculum which we developed for young neurosurgeons that covered all the research, most of the research pathway, from developing a research question, collecting data, analyzing, publishing, writing and publishing. Okay, and also how to build a career in research. So it's very possible. I think the young neurosurgeons, they are going to start their course for this year very soon. So it is very likely, and we're going to be having speakers from different parts of the world to come in to support such a course.
Very cool, and it's available for everyone. The course, who can attend it? The course.
So
Who
the
is
course,
eligible?
yeah, I am no longer the one organizing the course, because it's a chair now for young neurosurgeons, Kabulu from and another young neurosurgeon who is training in Morocco. So they are the people organizing. And I advise them that the best way for such a course is to target the young neurosurgeons and the residents, because these are the people who will need it, because in the coming years, it's going to be difficult to practice neurosurgery without having a sound knowledge of evidence-based medicine. It's difficult to publish to publish in a good journal without understanding the process of scientific writing and publishing. So the course is targeting the young neurosurgeons and the residents.
Thank you. Thank you.
We have a question from Dr. Dokponu. Thank you for this insightful talk. Great experience of clinical PhD. Please, Dr. Ebenezer, how will the clinical PhD experience help to achieve equity in neurosurgery research in LMICs?
Thank you very much. Yes, so that the one component is, like, as I try to show as a reflection, is capacity building. So capacity building is very important for equities, and to address like to point out and address local problems. So in that way, it will be valuable, and so I think and the collaborations to build this kind of programs also helps for experience sharing and partnerships. So it will help to build like a good program, and I think it will be strongly valuable for research equities. And with the previous point Magnus mentioned also, so as Ignatius said, like, it's very important that these online courses in research are very valuable, and especially if we tailor it to specific group of trainees, that will be valuable. For example, if we have a neurosurgery trainees who are going to start their research, so just before they start doing their research, there could be some introductory course which we can give, and if it has that kind of format, it will then when they just follow and do their practical like research following the courses, it will be valuable. I think it will be well taken. So we can target specific group of like audience, and that could make it these online courses very valuable. Thank you.
I just want
Go ahead.
to add that in addition to the course we were doing, with the Young African Neurosurgeons, Ebenezer and I participated in a course which we organized for the West African College of Surgeons. Yeah, so we're doing a lot of courses across the continent, not just for the Young African Neurosurgeons, not only for the residents, but we also did a course for the West African College of Surgeons, which is one of the biggest accrediting board in Africa for neurosurgeons in the western part of Africa.
And Andreas, you wanted to say something or no?
Yeah, I have a question for both our guest speakers, Ebenezer and Ignatius. You have both achieved a lot, and I hope, of course, it's only the beginning of a long and successful career for both of you, and we look forward to seeing you again. There is an initiative from the EANS Global and Humanitarian Committee, and Magnus here is our chair. The initiative is to pair up, create twin partnerships, if you like, between departments in Europe and departments in other continents, whereby clinical cases can be discussed, for example, via chat groups or a monthly meeting of complex cases, to create some sort of partnership, mentorship, and so on, which is bilateral, because there's some stuff that we can certainly learn from experiencing colleagues in Africa and vice versa. Now, we have now seen that Ebenezer had this sort of partnership with Bergen. I mean, you could not have chosen a city more far away from Ethiopia to do it, and that just shows you that distance is only relative. So do you think that such partnerships can be rolled out not only for clinical discussions but also for research at a more broad level? I mean, you're an example that it can work, and I'm sure it's not easy, but do you think it's something that we can promote at a bigger scale?
Yes, thank you very much, Andres. Yes, I think this should be something which we should promote in a larger scale, and to have a continuous collaborations and partnerships, and like to follow through the progress, like all the up and downs, the success and the failures, and pairing up institutes like which can work and a long way, like for a longer time, and who have different experience, different resources, different problems is very valuable. And I think like implementing this in a bigger model could be very valuable to make changes and for equity also. Thank you.
So before we end this webinar, I still want to ask one question to Andreas, but I have a personal request, and I will share my screen because there is something with this topic. We have thought about how to understand how oh, there's it. When we talk about research equity, we also need to look at how research is being published and if research actually gets published. So with various researchers around the globe, we thought about 2 surveys to look into publication bias on a global scale. And this is a survey that is directed to authors of papers in neurosurgery and see what their experiences are regarding publication bias. We want to do this globally, so that's why I'm putting this in this webinar, but eventually it would also go to the newsletter of the EANS to get a European view of this. And hopefully, so if you can click on the QR code and help us out with the survey, that would be very helpful. And while I have this up, I want to ask Andreas an additional question about how do you think the role of brain and spine So the role of the editorial board and the reviewers being mostly European, what do you do to try and minimize this inequity globally?
Thank you, Eliane. Always a good point to consider. Allow me two small disclosures up front. Number
Yes.
one, the editors in chief, we have one from Eurospine and one from the EANS. The two editors in chief are the ones who have discretion to maintain the quality, the standards of scholarship of the journal, and therefore the EANS and Eurospine societies have given them that freedom that the content of the journal should be at their discretion of high quality scholarship and so on. Having said that, the second point to make is that the EANS, I'm sure Eurospine too, but the EANS that we can speak of more confidently because we are members of it on this webinar, is that we have taken seriously the role of European neurosurgery in relation to global colleagues. And we also wish this to be reflected in our journal. So the editors-in-chief actually both believe that global neurosurgery is an important aspect of our professional duties. And in fact, the very first ever special topic issue of Brain and Spine was on global and humanitarian neurosurgery. This is totally open access, freely available to download. Thank you to a lot of you who contributed. It's available on Brain and Spine on else. If you put Brain and Spinal Severe on Google, it will come up. So I think the first steps have been made. We need to all be more conscious about it, make it known. Awareness of these issues is one thing, and part of the reason we're doing these webinars is to raise awareness, because we're all happy working away, very long days, very busy in our own bubble, completely unaware of the problems other colleagues are having a few thousand miles away, which may actually be very similar problems. So it may not be that it's actually very different. Sure, we may have slightly different resources, but the problems are all more or less of the same type. And I think it's good to learn from each other. And part of the EANS Global Humanitarian Committee is to raise awareness and to make these barriers less and less visible and break them down. The equity in research will be by elevating the ability of our colleagues in lower resource areas to share their experiences. The intelligence is the same, humans are the same. It's the resources that permit or prevent someone from devoting time to do it. And therefore, I think we need to partner up. We need to collaborate with intercontinental teams and allow and support those who haven't had the chance to learn certain simple techniques to do so. For example, someone may never have heard of a systematic review in something, but once they learn it, it's very straightforward, right? Or they may not have had the chance to do clinical research in the way that Western type journals want to see it. Once you show them and you mentor them, then they can do it. So it's not about rejecting and avoiding it, it's about mentoring and promoting it.
And what do we think? This is the last question, I think, and then I think everybody is is done. So the funding issue, which is a huge issue, it has become very, very apparent now in the US, that, you know, a lot of research funding has been lost. All these programs cost money. So how can we fund this? I mean, the idea is amazing to have, you know, twinning opportunities, people going somewhere, but how do you fund this? I've been trying to do a PhD for years now. No one is,
Yeah.
no one is funding anything. I don't have medical students. There's no, so how does?
I don't have the answer. I don't have the answer to a magic lottery ticket, but I can say this: you don't need to have huge amounts of money to do your own little bit. And nowadays, with the opportunities that are given to us through Zoom and WhatsApp and internet phone calls, speaking to Ignatius or Ebenezer now on WhatsApp, it's a piece of cake. Whereas 10 years ago, 20 years ago, it would have been practically impossible. So as long as we have internet connection in certain institutions, the beginnings of the collaborations can start with low funding. Funding is an issue everywhere. It's not just in Europe or Africa or abroad. It's everywhere. Is an issue. I mean, to do a small trial here, even if it's a very small non-interventional trial, will cost at least £1 million. Now you can do the same trial somewhere else with £100,000, but the cost of people's time is different in different places. But I think we need to be more inventive in how we do it, and we don't need as much as we think. Let's face it, there is an industry of this. There's also an industry of publishing, and we need to somehow get ourselves in the driving seat, as opposed to always making money for the big publishing houses, because they are very, very, very happy with this current open access scheme, when authors and institutions pay so that everyone can read it for free, but they are still making their money. So all that money could and should be channeled back into research, but it's not. So I think the landscape will change in the next 5 to 10 years, and it's up to us as professionals to have a serious conversation amongst ourselves how we want to drive this. Because at the moment, I don't think we're driving it. I think we're passive passengers.
Yeah, absolutely. Yeah.
Magnus, what do you think?
I agree. You are also wise, Andreas. I have to agree with you, of course. No, but it's a huge problem. I would like to, I would like to hear about Ebenezer's experiences, because you get some funding, or what did you get help with from Norway, Ebenezer, during this your PhD, because you have the experience.
Yes, and we had, thank you, Magnus. We had like a pre-existing collaborations in like neurosurgery training previously, also with the University of Bergen, and during my PhD training, I was able to get the funds to do the PhD at the University of Bergen, like the travel costs, my accommodations, and the cost for the courses and the training I get in Bergen. And from my institute, I was able to apply for a grant and get some fundings for to the data collections and some of the research work I do on site in Addis. So that was how my training was funded.
Okay, so we are about 20 minutes over time. I don't know about you guys, but I really, really liked this webinar. Plenty of room for discussion, interesting perspectives. I want to thank all the speakers, all your inputs, and amazing talks. And I wish you all a good night. For me, it's still afternoon, but a good night for you guys.
Thank you so much. And I would like to thank Anna Rick for letting me in finally, so I could catch up with you guys. So I think it's been, thank you so much, Eliane, for your efforts. When will next webinar be? Can we have a teaser?
Oosh, now you're asking me something. I think it's July.
Yeah, and what's the subject?
I think that's still in discussion.
Okay.
Does anyone have an idea?
Yeah, we are open for suggestions, aren't we?
Funding for research? No, I don't know.
We'll see what happens.
Yeah.
So thank you so much. Thank Ignatius and Ebenezer and Andreas. It's been a great evening.
Thank you to
Thank you,
everyone.
everyone,
Thank you,
especially
Andreas, Magnus. Bye-bye.
Yeah. Thank you very much. Bye.
Thank
Bye,
you.
everyone. Thank you for coming online.
Bye-bye.